All right, we're gonna go ahead and get started. First off, can everybody hear me without using the mic?
Yep.
Okay, perfect. All right, so my name is McKenna, and today I'm gonna talk to you about plant-based diets and their role for preventing and managing type 2 diabetes. So just kind of out of curiosity's sake, does anybody here maybe follow the plant-based diet or maybe vegetarian diet at all? That's one more hand than I was expecting. So I chose this topic because, so I follow a vegetarian diet, not totally plant-based yet, but kind of just wanted to use this as an opportunity to dig a little deeper into the topic and its implications specifically on type 2 diabetes because it's such a large population that we work with as nutrition professionals. So we'll kind of just review that disease state and what that diet looks like, and then dive into the most current research and how we can use that research in practice. So I know this will be a review for a few of you here, but so type 2 diabetes is the most common form of diabetes, with 95% of people who do have diabetes have type 2. And it's a chronic condition that results in too much sugar in the bloodstream, either because the pancreas no longer produces enough insulin or the body's become resistant to that and no longer uses that insulin properly. And there's several risk factors that can increase your chances of getting type 2. So being overweight or obese is the biggest risk factor. Having a sedentary lifestyle and family history also increase your chances. And chances also increase as you age or if you're of a certain race. So for example, Native Americans, African Americans, they're gonna have higher chances as well. Some of the symptoms of uncontrolled diabetes then can be increased hunger, thirst, and urination. You could also have blurred vision, poor wound healing, excessive fatigue, and just to kind of name a few of those. So then, according to the CDC, there's currently 30 million adults in the United States that have type 2 diabetes and 85 million with prediabetes. Of course, these numbers could be a little bit higher because that's just those who are diagnosed, and there's likely a lot of people out there, at least with prediabetes, that have it and don't even realize it yet. But with that being said, these numbers are expected to double by the year 2030, which is crazy to think about. But chances are you know somebody personally who has type 2, and you might have seen the different methods that they take to manage it, and kind of the different burden that comes along with managing that. So different ways you can go about it, kind of depending on the severity. So no matter what, you always want to regularly monitor your blood glucose. Losing weight can help. Following a healthy diet and exercising can also help. But if those are not enough, you might rely on oral medications or insulin. All of those can kind of come with their own problems though. So for example, with diet, carbohydrate counting is a common practice that's taught, but it can be kind of difficult for some people to grasp. So I know I tried to teach it to my grandma once, who was a diabetic, and she could not figure it out. But then if you do rely on the medications or the insulin, those can be really expensive, as we've probably all heard. So the average cost to the individual on just those treatments alone is about $9,000 every year. So that doesn't include any of their other medical expenses in that. So managing diabetes with diet, of course, is going to be more cost effective. But like I said, it can be kind of difficult for some people. So if we can find an easier way to manage that disease with diet, it might prevent someone from relying on those expensive medications. So what we know so far from past research of the plant-based diet and type 2 diabetes, on the prevention side of things, studies have shown that diabetes prevalence is 46 to 74% lower in individuals who follow a plant-based diet versus the general population. And on the management side, they found that those who already had type 2 and then switched over to a plant-based diet, on average had reduced glycemia, reduced blood pressure and blood lipids, and typically experienced weight loss as well. So a little bit more about what that diet looks like then. The name pretty much says it all. It excludes animal products while emphasizing whole foods kind of in their most natural state. So things like your chips and your soda, they can still technically be considered vegan, but they wouldn't be included in this diet just because they're not those whole foods, they're not based on plants. So by excluding those animal products and those highly processed foods, the diet's just naturally low in fat, cholesterol, and calories, whereas emphasizing plants makes it high in micronutrients, fiber, and water. And it might seem kind of restrictive because it does exclude a lot of foods that you might be so used to eating, But a big advantage over this diet versus others is that there's not really calorie restriction or counting of any of that kind, just because the foods that it does include are so low calorie and so healthy for you that it's really hard to just overeat them. And then just to show you kind of what a typical day of eating plant-based could look like. So just to show you that it can still be appetizing and still have a lot of variety in it, and that you don't necessarily have to give up a lot of foods that you're used to. So for example, for lunch, maybe instead of doing that chicken stir fry, you could turn that into a garden stir fry. You know, lots of different things that you can still add on there for that flavor and for that protein. So just to kind of show you that there's different ways to do that diet and have it still be appetizing. So getting into the research then, our first study looks at how a plant-based diet could affect beta cell function and insulin resistance. So impaired beta cells is a key factor of getting type 2 diabetes, but it's not typically a goal of the treatment. But we do know that beta cells are highly influenced by diet and activity. So they wanted to see if that plant-based diet could improve beta cell function and insulin sensitivity in adults who were overweight and insulin resistant but didn't have type 2 diabetes. So they had 75 participants included because beta cells are associated with weight. Being overweight was an inclusion factor. And then any history of type 2 diabetes or currently following either the vegetarian or vegan diet, they were excluded. So they were randomly assigned to groups. Both groups were asked not to make any changes to their medications they were taking or their physical activity. And then they all kept a 3-day diet record at baseline and at the end of the study. So the intervention group then, they received education from external dietitians who weren't doing the study. And they were to follow a low-fat vegan diet with a B12 supplement. So the diet really emphasized, the whole grains, the legumes, fruits and veggies. And then they were advised to avoid any refined oils, added salts or sugars. But then they were asked not to do any really calorie counting or any tracking of that kind. They were just asked to eat until they felt full. The control group then was just asked to not make any changes to their current diet. So what they were looking at then in the end primarily was that beta cell function and insulin resistance. They also looked at anthropometric measurements and then levels of cholesterol and plasma glucose. So 96% of them did complete the study. 2 left the control group and just 1 left the intervention group. And by comparing the diet records, they found that both groups had a very similar intake in calories, but the intervention group had a much smaller intake in fat and high glycemic foods, which could explain the results on this slide. So the graph shows insulin secretion in response to plasma glucose because that's ultimately how beta cell function is determined. So it should make sense that as the plasma glucose is getting higher, the insulin secretion is also getting higher. So the results show that at the end of the 16 weeks, the intervention group did have significantly higher insulin secretion compared to the control group, so ultimately they had better beta cell function. And then the table here is showing all of those secondary outcomes. So the anthropometrics, the cholesterol, and glucose. So the p-value column, which compares the between group differences, shows that they were all within significance. And if we look at the control group between baseline and the end of the study, all of their values stayed relatively the same. In some cases actually worsened. So for example, the fat mass, the visceral fat volume, all got worse at the end of that study. The intervention group, however, they did have significant decreases in all of those values. So then using the EAL worksheet, I did give this study a positive rating. Some of its strengths were its randomized design. That 16 weeks did give them enough time to adjust to that diet change as well as see any changes and effects of that diet change. And then the low attrition rate as well suggests that it was a sustainable intervention to follow, so that these are things that our patients could actually do in real life. And then of course it was applicable outside the research setting, so the participants did all of their own grocery shopping, all of their own meal planning, cooking, everything like that. Always some limitations when using self-reports though. So the participants might not be fully accurate on what they're writing down. They might have skewed ideas of what a portion size is. They might have eaten a certain way on the 3 days that they recorded, but differently on that time in between, and we don't really know. And then of course, Yes, it was 16 weeks long, but it can't really be used to assess the very long-term effects of that plant-based diet. But all in all, the results do suggest that the plant-based diet addresses both mechanisms of acquiring type 2, which again are beta cell dysfunction and insulin resistance. So our second study then looked at how the plant-based diet could affect individuals who do have type 2 or other metabolic diseases that are often associated with type 2. So they wanted to see if a community-based education program on the whole food plant-based diet could affect BMI and cholesterol in community-dwelling adults. So they had 65 participants from a general clinic. It did take place in New Zealand in a very highly impoverished area and where they had really high rates of type 2 and heart disease. So to be included, again, had to be overweight or obese, and then at least one diagnosis of either type 2 diabetes, heart disease, or high cholesterol, high blood pressure. And then any more serious physical or mental diseases were excluded. So again, they were randomly assigned to groups. The intervention group, once again, followed a non-calorie restricted plant-based diet with a B12 supplement. They also attended that nutrition program 2 times a week for 12 weeks, and the program focused on, behavior changes and skill development. So they had cooking classes on plant-based meals. Doctors would come in as guest speakers. They would go out to restaurants together and kind of practice those behaviors that they learned. And then the control group was just to receive their normal medical care based on that diagnosis that they had. So the primary outcomes, like we said, were BMI and cholesterol. Secondary outcomes, they also looked at changes in medication use, quality of life, and any risk factors for cardiovascular disease. So the program did go on for 12 weeks, but they followed up at 3 and 6 months, and also at 12 months just for the intervention group. So the first graph here just shows the average BMI values. And we can see that at 6 months, the BMI reduction was significantly lower in the intervention group compared to the control group. And they were able to still maintain those reductions at the 12-month mark, so long after that nutrition program had ended. And then similarly for the cholesterol, at 6 months, the intervention again had significant reductions, but the control group did not. And they had some sustained changes at 12 months, but it did go back up a little bit. And then for those secondary outcomes, so again, the medications, quality of life, and then risk factors for heart disease. So the control group did have an 8% increase in their prescribed medications, where the intervention group saw a 29% decrease, which I think is a really huge number. And then quality of life, that was measured with a physical test as well as a mental health test. And the control group did have physical improvements at 6 months. The intervention group had physical and mental improvements at 6 and then still at 12 months. And then only the intervention group had decreased risk factors for cardiovascular disease. And I just also wanted to put in there that 2 of the participants from the intervention group actually no longer met that diagnosis for type 2 diabetes at 6 months and still at 12. So they were able to not say they were diabetic anymore. So I also gave this one a positive rating. Some of its strengths were, again, that design, again, applicable outside the research setting. So the program took place in the community, and again, the participants did all of their own cooking and planning. And then again, that low attrition rate, which suggests that this is an intervention that, again, in real life, we might actually be able to see people follow. Some limitations, though, so prior to the start of the study, everybody did receive some education on the plant-based diet because, they just needed to know what they were getting into. So anyone in the control group could have adjusted their normal diet as kind of a result of that education. And there was actually one person in the control group who, in the middle of the study, switched to a plant-based diet. But of course, they continued on in that control group anyway. And then they also received increased testing as a result of being in the study. So they could have gotten more aggressive medical care than they would have normally, just because they were going in and getting tested more often than they probably would have normally. So both of those could have resulted in some of the improvements that the control group did see. But again, all in all, the program did lead to significant and sustainable reductions for all outcomes, suggesting compared to those who received normal medical care. And then getting into our last study, so this one looked at the immediate effects of a single plant-based meal on individuals with type 2 diabetes again. So they wanted to compare the effects of an M meal or a meat meal versus a vegan meal on postprandial incretin and insulin secretion. So it was a bit of a smaller study. They only had 20 and only included men. They did have to have type 2 diabetes for at least 1 or more years, and then 3 or more symptoms of metabolic syndrome. So again, those are high blood pressure, high blood sugars, triglycerides, high abdominal fat, and then low HDL. So they needed to have at least 3 of those 5. And then any more, physical diseases or significant weight loss in the last 3 months, they were excluded. So it was a pretty simple design. They were just randomly split into groups and consumed one of those 2 meals, and then their blood was drawn within the following 2 hours after they consumed it. They did have a week-long washout period and then repeated that procedure, so they had a little bit extra data to work with. And then the table here just shows the makeup of the 2 meals. So just to show you that they were very similar in calories and macronutrients. You will see the big differences though are in grams of sugar, saturated fat, and fiber. So primarily, again, they were looking at postprandial insulin and incretin. They also assessed insulin resistance and beta cell function again. So we will see some of these terms on the results slide, so just to kind of review that quickly. So GIP and GLP-1, those are those incretin hormones we're talking about for the primary outcomes. Very similar in action to insulin. And then amylin and C-peptide, they were considered tertiary outcomes, but they are on the results slide, so we'll just touch base on them. So amylin is a hormone that's co-secreted with insulin and acts as a satiety agent. C-peptide is a byproduct from forming insulin, so it's secreted at equal concentrations with insulin then. So all in all, these are values that after eating a meal, we want to see them go up, because that means that more insulin is being secreted, which means there's better beta cell function going on. So the results then show that the plasma glucose levels were very, very similar for both meals, with non-significant differences. However, the postprandial secretions were significantly higher overall following the vegan meal. All of them except that GIP, which is, it's kind of interesting that they had that one off. But the plasma insulin, satiety hormones, and then one of those incretins, all significantly higher just following that vegan meal. So I did give this one a neutral rating. It had some good, but it had a little bit more bad. Some of its strengths were, again, its design. They did use commonly consumed meals, so it was either a pork burger with coffee and creamer, or they had a veggie burger and unsweetened tea. So again, just to kind of show that these are results that we might actually see in the real world, because these are things that people are eating in the real world. And then the fact that they repeated the measurements after a week-long washout period, just so they did have that extra data to work with. Some of the limitations, though, that kind of made me give it a neutral rating. The participants did not have their diabetes diagnosis for very long, so the average was about 2 years. So their improvements in those secretions was a lot more likely than someone who was, chronically diabetic. And then they were only looking at the immediate effects of that plant-based meal, so we can't use these results to speak to any long-term effects of eating that diet. And then of course that small sample size that it only included men, and they didn't touch on any of the ethnicity of that men, so it's not really reflective of the general population. But the results do suggest the immediate benefit of a plant-based meal on improving beta cell function based on the postprandial insulin and incretin secretions. And I did just want to touch base on 2 of the other articles that I came across when putting this together. I didn't use them because they were just a little bit older, but I really liked them because they compared the plant-based diet against the conventional diabetic diet that we typically recommend. So the first study here looked at how glycemic control differed between those who followed the plant-based diet and those who followed that diabetic diet. And they found that the A1C was significantly lower in those who followed the vegan diet versus that standard diabetic diet that we recommend. And the second study then, much longer than any of the studies we saw so far today, went on for 74 weeks. And this one found that both diets actually showed sustained changes for weight and blood lipids, but only the vegan diet had reduced glycemia at the end of that. So how can we use this research then? I think because there's so much evidence that supports plant-based diets as being effective in both preventing and managing type 2, that it should be offered as one treatment option. Of course, it's not going to be appealing or appropriate for everybody, but for those that it is, it can be a low-cost and effective intervention. And the Academy of Nutrition and Dietetics does endorse the use of plant-based diets. So they stated in their 2016 position paper that they're not only nutritionally adequate, but have other health and environmental benefits as well. But of course, it's only going to be an effective diet if it's done properly. So by excluding animal products, there are nutrients that need to be made up for. So B12 is just one example. So it's really important that the dietitian would provide education on where to obtain all those nutrients, whether it be from food or if they do need supplements. Provide recipe resources, and the Academy does provide several of those resources for you that you can use. And then speaking of resources, if you or if you know anybody who ever wants to just try out any plant-based recipes, I really like these websites. They have some really great, easy recipes on there just in case you ever want to try out. That's all that I have. Any questions? Yes?
I have one. From the second study, there were pretty significant decreases in their cholesterol, and I believe it was the but then that changed for those in the intervention group, kind of went up again at the 12-month mark. Any idea why that might be?
That I'm not really sure, especially considering because the BMI stayed low and all of their other values stayed low. That was the only one that went back up. That was something in their discussion section of the paper that, just kind of one of those factors that weren't really sure on. Anything else? Yeah.
Could I see the slide again with the websites on it?
Oh, yeah. And then these are going to be posted on our research website.